Welcome to this lecture on substance use disorder treatment. First, we're going to take a look at the basic goals of effective treatment. So, of course, there's the primary goal, which is essentially to help move people towards abstinence and towards creating a drug-free lifestyle. That's the main idea of getting into treatment. But of course there's supporting goals as well that may be addressed during that treatment, and this helps to think about what other things are going on in that individual's lives and what other areas are they needing support in. And so those supporting goals become things like enriching job or career functioning, optimizing medical functioning, optimizing psychiatric and emotional functioning, and addressing relevant spiritual issues. So the National Institute on Drug Abuse, they put together a list of the top 13 principles of effective treatment, and we're going to take a look at each of those. And so the first is that addiction is a complex but treatable disease that affects brain function and behavior. So we know this to be true given the science that we understand about drug abuse and how that substance use can alter the brain structure as well as its function. And these can cause persistent changes, but it is treatable and we can do certain things to kind of reverse those changes that might have occurred in the brain. That's kind of the idea behind neuroplasticity, right? The idea that your brain can make changes. The second is that no single treatment is appropriate for all individuals. So it becomes really important to be able to match the appropriate treatment setting and interventions and services to each individual and what needs they're experiencing. Being able to do that will ultimately lead to better, successful outcomes. The third is that treatment must be readily available. So we know it to be true that if a person decides that they're ready to enter treatment and are willing to go, but then they find out that the treatment program is full, they have to be put on a wait list, anything like that, we know that that can really reduce the chance that that person is going to enter treatment again later when there is an opening. So it's great to be able to have, and crucial to be able to have enough resources and spaces available in these treatment programs so that when people are ready and willing to enter treatment, they have that opportunity. The fourth is that effective treatment attends to multiple needs of the individual, not just his or her drug use. This is kind of that idea behind the secondary goals that we talked about. So there may be other medical, psychological, social, vocational, or legal issues that that person entering treatment might be experiencing. And so for that to be able to be addressed in treatment is really important and can help increase the successful outcomes. It's also important that that treatment be appropriate to that individual's age, gender, ethnicity, and culture. So having that sort of relevance also increases the effectiveness. Number 5 is that remaining in treatment for an adequate period of time is critical for treatment effectiveness. So what we're finding is that at least 3 months in treatment is kind of the minimum that may be needed to really significantly reduce or stop someone's drug use. Of course, it's different for every individual, but that's kind of what's being noticed. Though a lot of studies are starting to show that around 6 to 8 months in treatment is kind of the ideal for really making that significant behavior change. Number 6 is that counseling, either individual or group, and other behavior therapies are the most common forms of treatment. So these are important elements in any treatment program, and they can include addressing things such as motivation to change, providing incentives for abstinence, building skills to resist drug use, replacing drug-using activities, improving problem-solving skills, and facilitating better interpersonal relationships. So being able to build up all those skills while in treatment is important. And number 7 is that medications are an important element of treatment for many patients, especially when they're combined with behavioral therapies. So this can be things like methadone or Suboxone or nicotine replacement products. All of those can be really important in providing a comprehensive treatment for an individual to help them gain sobriety. Number 8 is that an individual's treatment and services plan must be assessed continually and modified when necessary to ensure that it meets the person's changing needs. So being able to require and offer a combination of different services and treatments throughout the course of the treatment program is important to that individual's recovery, and something that as a substance use disorder counselor you'll be responsible for helping that individual figure out what those next steps should be as they are working through treatment. Number 8 is that an individual's Number 9 is that many drug-addicted individuals have other mental disorders. So this is the idea of co-occurring disorders, and it's something that we'll talk further in depth about in a few weeks. But recognizing that is important, and effective treatment programs will be able to address both of those issues that an individual might be experiencing, and at least to provide referrals and treatment for mental health treatment as well. Number 10 is that medically assisted detoxification is only the first stage of addiction treatment, and by itself does little to change long-term drug use. So definitely can be a really important step in someone first entering treatment and gaining sobriety, but continuing drug treatment further down the line is important after detox is completed. Number 11 is that treatment need not be voluntary to be effective. So even if it's sanctioned by the court, or if someone is kind of more or less being asked to go by their family or their employer or anyone else, it doesn't mean that the treatment will not be effective just because they haven't decided to be there on their own free will. Still providing treatment during that time can be very effective to the individual. Number 12 is that drug use during treatment must be monitored continuously as lapses during treatment do occur. So being able to monitor with drug tests on a regular basis can be a good incentive for individuals to maintain their sobriety and to figure out a way to help control the urges that they might be experiencing. And being able to monitor that also can provide an early indication and warning sign when someone maybe has relapsed and used again, and so being able to catch that early on will lead to a better outcome than it not being noticed early on in treatment. And then lastly, treatment programs should provide assessment for HIV, AIDS, hepatitis B and C, tuberculosis, and other infectious diseases, as well as risk reduction counseling to help patients modify or change behaviors that place themselves or others at risk of infection. So since we know that certain drug use can increase the risk for these diseases, it is important that treatment programs are able to offer services and testing around these, and to offer counseling and harm reduction and other safer practices when someone is engaging in those behaviors. So now we're going to look at current issues that we are presently seeing in substance use disorder treatment. And so the first is that medications are used more frequently to treat addiction. So since we have an understanding of how substances can alter brain chemistry, we also can use that with our use of medications to help with treating addiction. So certain drugs might be used as a medication to help lessen the withdrawal symptoms from a particular substance someone is using, or to lessen the craving for that substance. They may also be used as a medication to substitute for the drug of choice, so one that's maybe less damaging. Another example could be an antidepressant that is treating a co-occurring issue of depression. So those can be ways that medications are used in the treatment of addiction. Number 2 is that researchers can use the latest imaging systems and diagnostic techniques to visualize the structural and physiological effects of addiction on the human brain. So since we now have technology like CAT scans and MRIs and PET scans, we can use those to get a better glimpse and see what's happening inside the brain when these substances are used. And so we could see how the how certain brain circuits are lighting up and being activated or maybe not being activated when substances are used. And so this may include circuits like the survival and reward circuits, or motivation, or ones that influence memory and learning and control. And so these technologies help us to get a clearer sense of what's happening in the brain when these substances are used. The third is that new tools effectively diagnose addiction and better match clients to specific treatment interventions. So now there's more standardized tools that can be used to help practitioners and treatment providers know when an addiction is present in an individual, and so these different screening questions can be used, and we're going to take a look at some later on in this lecture. And there's also tools that can be used to help match an individual to the treatment that might be best for them at the time. And so like ASAM is a great example of that, and a screening tool that's really being used more and more by different treatment programs, and that can be used to not only identify the addiction but also to point to the individual to figure out what stage of treatment, what level of care do they most need right now. Number 4 is that there's a deeper understanding and appreciation of the neuroscience of relapse and recovery. So just as we also understand the science behind addiction, we also can understand more now the science behind relapse. And so instead of viewing that as a moral issue, or someone messed up or they did something wrong by relapsing, we can understand that the ways that the brain has been impacted by substance use also can still be affecting the individual when they relapse. So those changes that might have occurred in the brain can make it difficult for them to remain abstinent. So it becomes less about moralizing the relapse and more about understanding the science of why that might have happened, and again continuing to seek to build new connections in the brain and provide new opportunities for those skills to be built up so that they can continue to benefit from using these skills. Number 5 is that there's a greater emphasis on evidence-based best practices in treatment. So research is more available now, and so a lot of researchers are kind of looking at, well, which treatment practices are offering the best outcomes, and which are the ones that have been most successful. And so being able to conduct those conduct that research and make it available is really important in helping to further the best evidence-based best practices in treatment. Number 6 is that there is sustained evidence that coerced treatment or involuntary treatment, so maybe drug court, for example, is as effective, if not more so, than voluntary treatment in promoting positive outcomes. So we touched on this before, but again, just because someone is being mandated to enter treatment, it doesn't necessarily mean that it's going to be ineffective. So using drug court as an example of that, all 50 states currently have drug court programs where at any given time as many as 70,000 clients are being served. And they are showing some good success rates within those sorts of programs. So that's a good example of how mandated treatment can be really effective. Number 7 is there's a lack of resources to provide the treatment that has been proven effective. So we know that this is an ongoing issue in substance use prevention and treatment, that there's not enough resources. When we talked earlier in the semester about the cost of substance use to our society, we can kind of conceptualize it as 95 cents of every dollar is paying for those consequences or those costs to society, and only 2 cents of every dollar is going towards prevention and treatment. So prevention and treatment is vastly underfunded, especially when we compare it to the cost that it's adding to our society. And lastly, number 8 is that there is a continuing conflict between abstinence-oriented recovery and harm reduction as philosophies of treatment. So of course, a lot of treatment and recovery programs are really emphasizing abstinence and remaining sober, but we're also seeing the importance of what harm reduction programs can do. And so of course these may be examples like needle exchange programs or drug replacement therapies, such as using methadone or Suboxone. It might be substituting less harmful drugs for more harmful ones, so maybe using marijuana instead of heroin, or even decriminalizing or legalizing certain drugs. This all kind of fits under the idea of harm reduction. And so we do see a conflict with that, and we've seen that in our community as well, and whether or not people have been willing to support harm reduction programs. And so that's kind of an ongoing conflict that we have seen. And then a little bit about treatment effectiveness. So this comes from a study, the California Drug and Alcohol Treatment Assessment, where they looked at 1,850 individuals and they monitored them for 3 to 5 years following their treatment. And here's some of the results that they found. So there was continuous abstinence for approximately 50% of those treated, so about half of them continued to remain abstinent for 3 to 5 years after treatment. Furthermore, 74% avoided criminal activity. And looking at the cost savings, the state saved $7 for every $1 that was spent on treatment. So the treatment is kind of prevention in its own way as well. And they also found that treatment was most effective when patients received treatment for 6 to 8 months. So that was kind of the length of time that had the best outcomes. They also found that group therapy was more effective than individual therapy, and that drug of choice affected the outcomes. So when someone entered treatment for alcohol as their primary drug of choice, they had up to 2 times better outcomes than those who identified heroin as their drug of choice. And they also found that there were better treatment outcomes when the programs were able to modify and be culturally relevant to the specific target population that they were working with. So an example of this is a drug treatment program for women, and the program offering free childcare. So when that free childcare was offered, the success rates in that treatment program for the women increased. A little more about treatment effectiveness. So this is looking at the Drug Abuse Treatment Outcome Survey. This took a look at about 10,000 individuals that entered treatment in 100 different treatment facilities in 11 cities. So they looked at outpatient methadone programs, long and short-term residential programs, and outpatient drug-free programs. So looking at pre- and post-treatment drug use, criminal activity, employment, and thoughts of suicide. That's what they focused on. And so some of their results was that the use of all drugs was reduced by 50 to 70% in these participants. And they also found that short and long-term residential programs had the greatest effect. Also, most of patients surveyed stated that they did not receive the services they believed they needed. So next we'll look at the treatment episode data sets, which is research done regularly by SAMHSA. And so this particular one comes from 2016. So they took a look at everyone who entered treatment that year, ages 12 years and older. And what they found was that the average age at admission into treatment was 36 years old, and about 8% of those admissions were aged 12 to 20. Non-Hispanic whites were the largest group by ethnicity, so that was 62% of all admissions, and among that group, 39% were male and 24% were female. Non-Hispanic blacks represented 17% of all admissions, of which 12% were male and 5% were female. So that kind of gives us a little bit of a sense of the demographics of those entering treatment. They also noted that no prior treatment was reported by 36% of all admissions, and 16% had been in treatment 5 or more times previously. Also, self or individual referrals and court and criminal justice system referrals were the top 2 reasons clients sought treatment. So 41% for self and individual referrals and 30% for referrals from court or the criminal justice system. Also, most of those entering treatment received outpatient treatment, that was 61%, and 21% received detox treatment, and 17% received rehab or residential treatment. From this data, we also have this chart here. So this is looking at the primary substance use at admission, and so this is kind of looking across the time span of 2006 to 2016. So the yellow line with the circle represents alcohol. The red line with the triangle represents opiates. The green line with the diamond represents marijuana. The yellow line with a square represents cocaine, and the blue line with the triangle represents methamphetamine and other amphetamines. So we can kind of take a look at the trends that we see there. So we're seeing a pretty steady increase of people entering treatment for opioid addiction. That's even surpassed alcohol just by a bit, starting maybe 2013, 2015, I guess, is what it more so looks like. And so that's kind of become a little bit higher than alcohol, but overall alcohol has kind of remained consistently around the 40 or so % range and has been one of the higher rates for why people are entering treatment or their primary substance use when they enter treatment. This chart takes a look at the type of treatment service at discharge, so it gives us a sense of essentially how many people are entering what types of programs, which of these types of programs have the most people, more or less. So outpatient is definitely the biggest one. They're about 39% of the population entering treatment is going into outpatient. About 20% enter detox services. Intensive outpatient is 13%. Medication-assisted opioid therapy or detox is 11%. Short-term residential, 10%. Long-term residential, 8%. And less than 1% are entering and being discharged from hospital residential. Then this graph takes a look at when people are discharged, why or what's the reason behind that discharge. So the blue section in each of these categories is going to be that they've successfully completed treatment. The red bar is that they were transferred to a different treatment program, or maybe moving on to a higher or a lower level of care. The yellow is that they have dropped out of that treatment. The green is that they were terminated or asked to leave by the facility. And then the light blue is other. So we can definitely see some interesting trends when you take a look at those different bars, and so each of those sections are looking at different types of treatment service. So for example, we could look at the second bar in, which is detox services, and so with that we see a large percent of the people entering that treatment, they're discharged for successfully completing the program. So it's somewhere over 60% are successfully completing detox. Whereas if you look at the last bar, which represents outpatient medication-assisted opioid therapy, we see that that successful completed of treatment, that blue section at the bottom, that's a lot lower. So that's less than 25% are successfully completing that type of treatment. And it looks like the largest group in that treatment is the yellow section, which is that they're dropping out. So this kind of gives us some interesting information about how successful these different treatment services are in terms of this study. So what does treatment involve? So treatment involves different aspects, and these are all going to be things that you are working on with the client when you're working as a counselor in a treatment program. So the first step will always be assessment. So thinking about why the person entered treatment and what's their primary drug of choice, what impairments is it causing in their life. Going through that assessment with the individual to get a clearer sense of what's going on and why they're here. Building rapport is also an important part of treatment, and so you as the counselor are helping to facilitate a therapeutic relationship between you and the client. Treatment planning is another element, and so you'll be working on creating a treatment plan to help guide the individual's time in treatment and helping them think about what goals do they want to reach while they're here. Documentation is another part of that. So of course, whenever you're meeting with a client, you're writing case notes on that, you're documenting your assessments and your treatment plans. All of that is going to go into a file for that client and will be kind of the proof showing what work you've been doing with them. Another aspect of treatment is relapse prevention. So helping that individual think through what skills they're going to need to use when they are outside of treatment to help combat those cravings that they might feel, those urges, or what they may need to do to make changes in their lives so they're not tempted to use in certain situations or when they're around certain people. So it's really kind of guiding that plan for what they're going to do when they're out of treatment, but also when they're currently in treatment, that is kind of part of that as well. When they've gained a little bit of sobriety, there's always the chance for relapse, and so thinking through and working through those plans is an important aspect. Termination is another part of it. So once you've come to the end of your time working with an individual, you're going to be thinking about kind of wrapping up that work and having that conversation with them, and again helping them think about what the next step looks like and other ways that they can seek out support in their life. So along with that becomes discharge, and so there's of course paperwork involved in that, and so you're doing discharge paperwork and helping finalize plans for preventing relapse and connecting them to other services and kind of summarizing the work that you've done in treatment and the ways that they maybe have met the goals that they set out in the beginning when they first entered treatment. And then lastly, aftercare, so programs and supports that are still available to that person once they leave your treatment program.